All right, then. Now it's time for a health discussion. Now, what our chef is doing with her hands has a lot to do with some motion in her wrists. And one of those doctors that helped me with some bone challenges some years back is Dr. Lawson. Today, we're joined by Dr. Babajide Lawson, the lead consultant orthopedic and trauma surgeon at Reddington Hospital. Now, he is sharing what we need to know about bone infections, also known as
Osteomyelitis.
Osteomyelitis.
Good morning.
Good morning.
Thank you for having me.
Welcome back to the show.
Thank you.
When I heard bone infection, I first of all did like this, because it feels like the bones are encapsulated in so much. There's the skin, there's muscle, there's fat. It's all the way in there, and then suddenly, God forbid, there's an infection in a bone. How on earth does that happen?
Yeah, that's a very good question. I mean, at this rate, you will get your medical license very soon.
Thank you.
Yeah. Okay, so you're very correct. And like you said, God forbid, well, it's not that common a problem.
Okay.
The first thing you should think about is it also depends on the age. Okay. So usually in kids, the tendency is because there's an infection in the body that might now move around and then settle at some points in the bone. Usually that would be in children that are not well nourished, immunocompromised. Sometimes for a particular sect of people with sickle cell disease, because the condition makes a fertile ground for that to happen. In adults, however, this may be seen in individuals with diabetes, people that have had accidents, trauma would direct inoculation of organisms, open fractures.
Okay.
And then, of course, sometimes it can come as a complication of surgery for bones.
But this is, it feels like an extremely serious thing to deal with. What are those indicators that you see as a doctor that tell you this could be the case? Well,
again, like I said, at this rate, you will get this license very soon. Because you said it's very serious. So we call it a disease of 40 days or 40 years.
Wow. Okay.
So, and the implication is that if a person does get a bone infection, the aim is to try and eradicate it within 6 weeks. Wow. If you're unable to do that, then it moves into the chronic stage, whereby it now becomes something that has more complications and is more difficult to take care of. So you don't want it to get very bad.
So visually speaking, can you ever see, as a doctor, when you see a patient come through the door into your consulting room, can you see that it's a bone infection? Or is this something that has to be diagnosed with certain tests?
All right. So in the early stages, what we call acute osteomyelitis, you listen to the patient, and then you need to run some blood tests to be able, but it's something that is based on, we call it a high index of suspicion. So you listen to the patient, you take a look. They usually have difficulty in walking, there's bone pain, there's fever, all the hallmarks of infection, are there. But by the time you can see the clear-cut evidence, things like sometimes they have sinuses, discharging sinuses, so they have a wound and it's always coming, pus is always coming out. Sometimes they may have deformities. Sometimes they come with fractures, what we call pathological fractures.
Wow.
So by that point, it's already morphed into the chronic type, which is the 40-year variation. So the first one is this 40 days variation.
Okay, so that 40 years, what exactly does that mean? It doesn't mean that it's going to take 40 years for it to clear,
it's just
right?
It's just a way of describing it that it takes long to...
Okay, so you did mention fractures, basically trauma could lead to it. So for, we've heard many times people being told to go to orthopedic hospitals after accidents, and then sadly our roads have led to so many different types of accidents, and of course our drivers have led to so many different types of accidents. When they get there, right, and they're going through some treatment, are there things they can ask for, things they can do to make sure that their care is 100%, to make sure that these things never happen?
Okay, So usually patients come in, you want to ensure that they're attended to on time, or the patient is brought in on time. And then the wound is covered properly. I mean, first aid at the scene of the accident. Ensure that things are clean, you know.
That at the scene of the accident thing you just said, a lot of people don't have that first aid information.
So that's where the problem actually starts from, because you need to get them early. If you don't get them in early, if the environment is not appropriate or adequate, then chances for inoculation, infection becomes high. And then by the time you get in, by the time the patient gets in, things like getting medication, starting early treatment is very, very important. Especially the use of antibiotics, just to, so we call them broad spectrum, to cover the usual suspects or organisms that can cause that. So you want to start that early before you're able to now pick out the particular organism that might be there. So you want to start early so that you don't give it room to multiply.
So I want to come back to the other aspect of patients. You mentioned adults, a certain area, and then you mentioned kids. So for now, who the truth is kids are getting knocked around all the time. They're running up and down. They're having slips and falls, scrapes and bruises. What can parents do to make sure that they're covering their kids the right way?
Fortunately, it is not a very common problem, number one. Number two, eat healthy, be in a general good state of health. That's the first step. Secondly, when there are injuries, more often than not, wash out, clean, pain medication, and watch out. But once the injury is severe, there's a significant depth, and they should get that looked at the hospital so that someone can advise, get x-rays done to be able to get the appropriate treatment in time.
I've seen it so many times where you see a child just fell down. Don't worry, the child will be fine, and then maybe they find some antiseptic liquid, they pour it over it. And is that enough? Is that actually enough?
Again, you have to individualize and look at, more often than not, again, like you said, the bone is well covered. So it's unlikely that just the regular bruises and scrapes would cause that. But sometimes that can result in it, especially over the leg. There's just skin over the bone here. So if the wound is deep enough and is contaminated or dirty enough, it can potentially lead to a problem in kids.
So I would like to just, touch on first aid. If, for instance, you see someone has a wound on the leg, an open wound on the leg, what is the first thing people should do?
First thing is ensure that you get clean water, wash it out, just to ensure that whatever debris is washed out. Then you can get some alcohol for the edges, and then a clean bandage or something applied on it, and then take it to the hospital. So you did say it's not common, but I like to hear statistics. Do you have a ballpark? Like, I'm just saying, the likeliness of things like this to happen. I'm hoping it's very unlikely. So this is set up.
Yes, statistics. I'm just thinking, out of every 10 patients.
And it's not even, you probably will struggle to get 1 out of 10.
All right.
You'll struggle to get 1 out of 10.
That was very helpful. I can breathe now. All right, then. So general bone health, for people that are recovering from infections, are there certain things that they can do?
So first thing is regular follow-up, follow instructions as given, because you still have to individualize. So medication, ensure the child is eating healthy. For individuals like sickle cell disease patients, you need to optimize them so they're taking their regular drugs, they avoid stressful conditions, well hydrated. I mean, that's just the...
All right. Thank you, Dr. Lawson. I have a feeling there's someone out there that's learned something today. If you have any questions, use our hashtag WakeUpNigeria on TVC as you post them. We'll see if we can respond to them online. Thank you so much for joining us. We're going to be taking a quick break and be back with more.